Good morning, everybody. It's Dr. Polack, Progressive Pediatrics in Union City and Bayonne, New Jersey. We're here to let you know that we're here for you. So don't feel alone during the pandemic. We're working for you 7 days a week. Not only are we working to help you and your children feel better, but we're also collaborating with other providers in the area. So today I'm with Jenna Welsh. Jenna?
Hi, my name is Jenna Welsh. I'm a licensed associate counselor at High Focus Centers in Cranford, New Jersey. I work with children and adolescents as well as parents to assist with all mental health therapy services.
Great, thanks. So today we want to talk about mental health issues that both the parents and the children are, going through during the pandemic. So Jenna, tell me a little bit about what kind of problems you've been seeing recently, both in parents and in children and adolescents.
So, a lot of the most recent things that I've been seeing has a lot to do with some of the losses that the families have been experiencing. So for the children in particular, it happens to be the loss of school. So not being able to return to school at the end of the year and do all those end of the year tasks that the children really look forward to, like prom, graduation, and a lot of them have missed their sports teams for the spring. So I've been seeing a lot of that. For parents, I feel that they've been struggling with the dual role of being a parent and a teacher and a counselor at times. So those are some of the major areas that I've seen.
Yeah, same. We've been having similar issues at the office. And so tell me a little bit about how you're helping children deal with everything. And then tell me a little bit about how you're helping parents to think about things.
So with the children, we've been talking a lot about maintaining that normalcy. So being sure that they're able to still see their friends, whether it be virtually or socially distant. And with parents, we've been talking a lot about helping them maintain structure. So for parents, I think they're struggling with the idea of how do I work? How do I help them with school? How do I do all these tasks? So this idea of having a schedule and a routine has been really helpful in managing all of the feelings.
Right. And you had mentioned with me earlier to let the children know, okay, for these 2 hours, I'm going to be your parent, right?
Yeah.
And then for the following 2 hours, I'm going to be your teacher. And after that, we'll play. So let the children know what to look for, right?
Exactly. So like setting those healthy boundaries and just being really straightforward with communication on, all right now it's school time and I'm going to do this with you for a little while. And that way they have clear, definition of, all right, mom's teacher right now, mom's mom right now, and that helps keep the things more even throughout the day.
Yeah, I wonder if they should have different outfits for different roles. That would be an interesting concept, right?
Right, wearing
exactly, wear different hats, literally. Okay. And the other things I've been seeing a lot in the office is tell me a little bit about how to deal with teenagers who are really having a hard time with the lack of structure and also with issues of anxiety, sleep issues. Tell me a little bit give me some managing tools, maybe.
Okay. So for children who are struggling with anxiety, I think a big thing is getting outside. Because I often find that we forget to do that. So with the whole stay-at-home order, our thoughts are, okay, like I can't leave my house, I have to stay here. So one of the big things that we've been suggesting is having the children, run around outside, exercise, and kind of try to get some of that normalcy back into it. If they play sports, say they play lacrosse, get out there and throw the lacrosse ball around. Some of the other things that we've been really working with families and children on are maintaining the structure. So it can be hard to get up in the morning and get dressed when you only have to go 2 feet from your bed in order to do whatever schoolwork it is that you have to do for the day. But it is important to maintain that consistency so that habit continues, especially for when we do have to return.
Which it definitely eventually will happen. Exactly. Yeah. Exactly. Do you have any kind of nuggets that you tell either teenagers or parents to keep in their head? Any thought patterns that can help them out when they're having a hard time?
I think a major thought pattern that we suggest can often be we're going to get through this. We're going to figure this out. my big phrase is, we'll figure it out, right? Because I think sometimes with all of these things going on, we often feel lost, like there's a loss of power and a loss of control over what's happening, which can be really overwhelming. So reminding yourself that you do have control over many things that are going on and you can be successful, having that positive mindset of, well, we've got this, we can do this, is usually very helpful.
Right. And don't forget that this is temporary, guys. Okay. Both parents and kids, this is not going to go on for the rest of your lives. Of course, it is going to change all our lives, and our normal will be different, but we're not going to be in pandemic mode for the rest of your lives. And this is a temporary situation. It will end. You will be able to have school and college and enjoyment and proms in the future. So don't focus on just this is going to be forever.
Absolutely.
Awesome.
I agree.
Awesome. Jenna, can you go over a few red flags per age group if you could? Like, what should the middle school parents be looking for versus the teen parents, please?
Sure. So I think it's really important to know your child's baseline first and foremost. So every child's a little bit different. So for some children, they enjoy socializing. That's something they're already doing on a daily basis. Other children enjoy more of the quieter activities like reading and things like this. So just knowing what the baseline is, I think, is really key. For middle school students, I think some red flags could be irritability, defiance, things that they haven't normally done before. So I've actually been seeing a lot of children who have never been disrespectful before suddenly becoming extremely disrespectful, which I see as probably a result of the anxiety that they're experiencing, and they're using that as a way to cope. For the older adolescents as well as middle school children, I think it's important to make sure that isolating is not occurring. So it's one thing that we have to stay at home, but it's another thing if we're refusing to spend time with family, not speaking to friends, kind of just staying in our room 24/7 and not interacting. That would be a major red flag that something deeper is going on.
Okay. So for teenagers, it's basically isolation. And for younger kids, it's not just isolation, but also defiance. Is that right?
Yeah.
Yeah. I also tell parents to be on the lookout for big changes in either their sleeping habits or in their eating habits. If they used to eat a small amount and now they're tripling that, that amount that they're eating, hold on, they're compensating for something. Let us know. Come to us, please. There are many articles in the medical literature now on the potential long-term effects of this kind of anxiety on children and on adolescents, and that if it's addressed early enough, it would be much better for that child and adolescent than if it's left, to fester for years to be dealt with over a long period of time. So I do advise parents to come to us and to get help when it's absolutely necessary. All right, Jenna. So I'm going to tell people again, one more time, that we are there. Progressive Pediatrics is there. So we can talk to you guys virtually if you'd like. We could see your child if they're not sick. And we're there to support you, not just for physical issues, but for mental health issues. Jenna, can you let our community know what kind of resources you have available for them?
Sure. So High Focus Centers has several on-site locations throughout New Jersey. There's 3 in northern New Jersey, 2 in Paramus, 1 in Parsippany, 1 in Cranford, several in South Jersey as well. We're currently offering telehealth mental health services. It's primarily group therapy, but we also offer individual and family therapy, as well as we are just recently rolling out a trauma education group to assist with some of the responses we've been seeing to COVID. And additionally, we have a parent support group that is once a week for any of the patients that are enrolled in our program. We also have a psychiatrist on staff. So it really is like an all-encompassing mental health treatment facility. We also offer substance use treatment as well.
Great, thank you. So how can patients find you?
So if you go online and you Google High Focus Centers, there should be a website that populates where you can make a phone call to the intake department, or you can also message them online. There's a button to click, and you can schedule an assessment to come in, and so we can see, what areas would be best for you.
Awesome. All right. Well, everybody, have a great day today. Enjoy your weekend. And it was great talking to you, Jenna. Have a nice day.
You too. It was great talking to you too.